Okay, we are Team 9 and we'll be presenting on delivery of mesenchymal stem cells, paracrine factors using porous acupuncture needles for the rotator cuff injury. I'm Edward Thatcher Van.
I'm Jamie Moore.
I'm Albert Langette.
And I'm Brooke Klepper.
So this slide is on the clinical need.
Our group saw that there was a need for a better method to help treat rotator cuff injuries. A rotator cuff is one of the most commonly injured tendons. A person who injures their rotator cuff will feel weakness in their shoulder and it won't allow them to perform tasks as they normally would. The rotator cuff is made up of four muscles: the supraspinatus muscle, the infraspinatus muscle, the teres minor muscle, and the subscapularis muscle, which hold the humerus into the ball and socket joint on the shoulder. It typically happens to those who are fairly aged and athletes who do a lot of overhead motion. The types of injuries are impingement, tendinitis, and tears. Tears are currently the only thing that can be treated and is usually done through surgery.
In order to prevent these three rotator cuff injuries, the most effective treatment will be
Our solution is to combine electroacupuncture with stem cell delivery for an in-office preventative treatment. There are two main parts to our design: creating porous acupuncture needles made of stainless steel with hollow cores, and culturing HMSCs in a conditioned media so that they overproduce angiopoietin-1, vascular endothelial growth factor, and platelet-derived growth factor. For our procedure, an MRI scan will show the areas with most severe inflammation. The needles will be loaded with 250,000 HMSCs each and then inserted into these parts of the tendon. One study showed that the volume of stem cell injections for exploiting paracrine factors used 0.2 milliliters of cell suspension. Our needles are designed to be 50 microns wide with a 10 micron opening at the tip, which improves the patient's comfort as well as serving the function of only releasing factors without releasing the HMSCs themselves. The volume that we could have in one of our needles is 0.05 milliliters. Therefore, we would need 4 of our needles in different parts of the rotator cuff to provide equal volume to the study. However, this is also to be handled on a case-by-case basis depending on the severity of the inflammation from the MRI screening. 1 to 5 needles is the effective amount. Our specially designed needles will work simultaneously with regular acupuncture needles in the hand, the elbow, the back of the neck, and the top of the head, which have been shown to signal the hypothalamus to increase the amount of MSCs in the bloodstream. Our needles will stimulate the target area to localize this response, and the needles will be taken out after about 2 hours.
The main benefit of our project is to treat inflammation for rotator cuff impingement and tendinitis in order to avoid a full tear. As mentioned previously, the only treatment that exists is surgery for rotator cuff tears, which can be painful and expensive. Avoiding a full tear will thus avoid the need for surgery and save the patient money. Additionally, the needles holding the stem cells will be removed, helping reduce costs with FDA approval of the device. A final benefit is that this procedure is one that does not require invasive surgery and can be done in office.
As for the costs, we have broken it down by production costs and patient costs. The first production cost is manufacturing the specialized needles, where regular acupuncture needles of this size can range from $3 to $10. This price will have to be adjusted in order to fit the manufacturing of our design, which involves a hollow core. In addition, we will be using MSCs that are purchased rather than derived from the patient. The cost for 1 million cryopreserved bone marrow-derived HMSCs is around $800. Though it is more expensive, it will be less painful for the patient to be given cultured MSCs rather than removing the patient's bone marrow. Another production cost is the electroacupuncture kit, which can be about $80. The final production cost is training the physicians to perform the procedure. As for the patient costs, the cost for the procedure includes an MRI, which can range from $500 to $4,000 depending on the facility, and the cost for the treatment, which will be determined based off of the final production costs. As for time, the treatment will only last about 2 hours.
There's no direct competition that treats all 3 types.
Recommendation is either physical therapy through exercises or just rest. However, often patients' conditions deteriorate without surgical intervention. One study reported over a quarter of participants with rotator cuff injuries in PT needed surgery 3 months after starting therapy. PT can also take up to 2 years to show improvements in rotator cuff usage. Acupuncture is also a common alternative to PT. There's evidence that this technique decreases pain. However, most studies only report temporary benefits. So introducing paracrine factors into the needles will provide long-term healing and not just pain management.
Rotation Medical introduced a patch from bovine tendon that integrates with the rotator cuff. They have reported recovery in only 1 month with PT afterwards, but it is an invasive surgery and you will be in a sling for 2 weeks. It also uses bovine tissue, which is not compatible with everyone, and it only treats tears.